Hello. It's lovely to meet you. I understand that you've been having some issues with your skin lately, so we're going to talk through what's been going on, and then I'm going to have a really good look for you and see if we can get to the bottom of it. Alright? Good. Okay. I'll just make some notes then about what's been happening. So, if you could start, please, by just describing to me the symptoms that you've been having, what's been going on with your skin lately. Okay. And when did that start? See, yeah. Okay. Did you have any sudden lifestyle changes or anything that you can think might have contributed? Not that you're aware of? Okay. Do you have any allergies? Okay. And is it just on this left side of your face then? Or have you noticed symptoms in other areas? So on the right as well, but just slightly less. I see. Okay. And how does it feel on a day-to-day basis? Is it feeling very tight? Is it feeling dry? Okay. We'll have a look at that, don't worry. Alright. Let's talk a little bit then about your existing skincare routine, so the things that you are doing that might impact your skin and its overall health at the moment. So you said there have been no drastic changes, so I assume you haven't started using any new products lately or anything like that? No, just keeping things the same as normal. Okay, alright. Could you tell me then how much water on average are you drinking per day? So you don't drink much water, but things like tea, fruit juices. Okay. Okay, and just tell me a little bit about your diet. So are you vegan or vegetarian? Are you eating a lot of processed foods or a lot of meats? What does your average diet on a daily basis look like? Okay. Yeah. And that hasn't changed. Okay. And you're not aware of any lactose intolerance or gluten or anything like that? Okay. Tell me a little bit then about what products you are currently using on your skin. So any makeup, any creams or serums, anything like that? Okay, and is that every day? And I'm sure you know that I'm going to ask, but are you using sunscreen on a regular basis? Okay. Right. So in terms of your skincare products then, it's quite minimal at the moment. Are you open to using more or introducing some into the routine if needed? Just to make sure you're not on any medications at the moment. Okay. They can affect the skin, so it's always important to check. Tell me a little bit about your daily routine with your skin then. So how often are you washing your face, for example? So just generally in the shower? Is that every day? Okay. That makes sense, yeah. Okay, lovely. Are you aware of any sensitivity to any skincare products that you've used previously? So have you ever had a reaction to any face masks that you might have used, any moisturisers, any sunscreen products? Okay. What about any kind of washing powders or even the sun itself? Animals, anything like that? Alright. I think we have enough to be going on there. I think what I need to do really is just have a good look at what's going on with your skin. Is that okay? That's it. I will need to get quite close up and obviously touch your face, if that's okay. My hands are nice and clean. I have sanitized them, but I will put some gloves on anyway. And I am going to start just by cleansing your face. We really need a blank canvas so I can see what's going on. So any skincare you've used during the day, any makeup, anything that's built up on your skin over the course of the day, I'm just going to remove it now and have a close-up look at what's going on underneath. Alright. Good, okay, let's get started then. So I have some cotton wool pads. I'm just going to use those with a special cleanser that we have that will clean everything off of the skin, alright? Just a couple of spritzes of this one. Like that. And then if you could just close your eyes for me for a moment, I'll start on your eyes. Lovely. And then I'm just going to blend across your forehead, right to begin now with the examination of your face, alright? Okay. So I'm going to begin in the zones on your forehead. Your brows now. To your temple, on the left side of your face, just having a look at the skin there. Looks good. Same on the right side. Just work into your eyes. Close your lids for me a moment. Looking at the lids themselves. And down your nose. going to ask you to pull some facial expressions for me, alright? Good. Okay, if you could please raise your eyebrows for me as high as you can. That's it, and relax them back down again. If you could please smile for me as wide as you can. That's it, nice and open. Show me those teeth. Good, and relax down again. Okay, and if you could scrunch your face up as tight as you can. Eyes really tightly closed, mouth really tightly closed. Very, very good. Okay, if you could stick your tongue out for me, please, as far as you can. That's it. Well done. Okay, now I'm just going to hold my hand over the right side here, and I would just like to have a quick look at the symmetry of your face. So if you could smile for me and relax. And smile for me. And relax. Very good. Okay. Just see if the elasticity of your skin seems good. Which is good because it can be a sign of dehydration if it's not returning to its usual shape. Okay. What I'm going to do now is just touch lightly on different areas of your face, and I would like you to tell me if they feel tender or like they might be bruised. Alright. Okay, starting on your chin, moving along your jaw. That's it. I'm just going to work my way around your face just to tell me any of these areas feel tender or bruised, okay? Onto your temple and across your forehead. All feeling good so far? Yeah. How about over your nose? How does that feel? Okay. I'm going to have a close-up look then with a little light. I just need you to either close your eyes or you might want to look over my shoulder. Try not to look at the light so that it doesn't blind you at all. It's not too bright, but you might not want to look at it just yet. Okay? Just having a really good close-up look here now at various areas of the skin. line here. That's it. All the way along. Over to this side. Wonderful. Okay. Good. Right. The final check I'm going to do is just to see how oily your skin is or not. So I have these little sheets here. They are oil absorbing sheets. So if there is any oil on the surface of your skin, it will just show up. I'm going to take one of these now and just press it onto your face, okay? Just pressing firstly across your forehead. Down onto your cheeks and across your nose and the T-zone. And onto your chin. So let's have a look here. So just going to hold it up to the light. So you can see the areas where the oil absorbing sheet has gone a bit darker. That's just where it's picked up a little bit of oil from your T-zone there. So I would suggest that you actually have a combination skin. You do have ever so slightly enlarged pores in your T-zone, so that's on your forehead, just between your brows down onto your nose and slightly on your chin as well. There aren't really any blackheads there, which is great. So you're obviously doing a good job of cleaning your skin, keeping it clear. But your body is overcompensating for perhaps a slight lack of hydration by producing excess oils, which is something that we can look at. I say combination because in the outer perimeters of your face, towards your cheekbones, I can see that you have slightly drier skin. Also across your forehead, around the edges, it's just slightly drier. Do you have some redness developing in your cheeks? Just slightly, which is probably the symptoms that you were describing to me earlier. It does look ever so slightly worse on this left side than it does on the right. I agree with you about that. I can just see the beginnings of it as well in your forehead. Chin looks okay. So I can't see any signs of sun damage yet, which is great. But I think you would benefit regular sunscreen into your skincare routine. I understand that because your skin is oily, it can feel quite heavy on the skin and greasy, but we do have some really great sunscreen products that I can recommend for oily skin. Okay, I think that perhaps what's been happening is that the cleanser, the facial cleanser that you are using over time, has just altered the balance of your skin. It's stripped your skin just a little bit too much, and that has created sensitivity in your skin. And I know you said that you haven't made any sudden changes, but it could be something as simple as a day out in the sun, a little bit too much sun exposure, which has brought on this sudden sensitivity. Could even have been something that you ate. No, I wouldn't say that it was a rash or a specific skin condition. It just looks like a little bit of sensitivity to me that we can address quite easily. That's it. Overall, your skin is in really, really good condition, and you're doing a really great job with it. You don't use too many products, which is fantastic. We can keep that number down for you and keep things nice and simple, okay? Good, I'm just going to remove my gloves a moment and then we can discuss some treatment options. Okay, how are you doing? Good. So my recommended regime for you is going to be to drink more water. I understand that you are getting a good amount of fluids already, but just water itself with nothing in is going to be absorbed so much more readily into your system and really help to hydrate you. So as a minimum, I would like you to have a glass of water in the morning when you wake up, and ideally another glass of water before you go to bed, at least an hour before you go. Okay? Good. I'm also going to recommend you a sunscreen. You don't have to choose the one that I recommend, but I'll have it ready for you down the hall at reception if you do choose to have that one. It's really, really good because it's non-comedogenic, so it's not going to block your pores. It's also non-greasy, so it's not going to make your skin more shiny and more oily. Okay, good. I also have a cleanser that I would love to use on you, and that's because it's super, super gentle. It's going to really help to keep the skin lovely and clean. You can use it twice a day, but it's also going to help to restore your skin's natural protective barrier. So the natural pH of your skin and the protective barrier that helps to protect it from day-to-day exposure and things like that. Okay? That's it. So twice a day you can use that to clean your face, morning and evening. If you want to clean just as you normally do in the shower, that's absolutely fine. But I would recommend twice a day if you can, just to remove any build-up of oils, sweat, dirt, products that you've used during the day. Good. How does that all sound? Wonderful. Let's try that for a month then, and then I will book you back in so you can come and see me and we can review how things are going. If we need to make further adjustments to your skincare routine, then we can most certainly do so at that point. Alright. Good. Well, it's been lovely to see you today.